As we have already discussed about dehydration, dehydration is a condition that occurs when the loss of body fluid, mostly water, exceeds the amount that is taken in. Most common causes of dehydration in children is diarrhea. Depending on the concentration of sodium, the ECF reduction is classified into iso, hypo, and hypernatremic dehydration. Isonatremic dehydration, the sodium loss is parallel to the water loss, so that the sodium concentration in the ECF or the plasma remains normal, approximately 140 milliequivalents per liter. It occurs in about 50% of the diarrheal cases. ECF decreases and ICF is normal. Hyponatremic dehydration. Sodium loss is more than ECF loss. It occurs in 40 to 45% of the diarrheal cases. Because of low osmolality due to reduced sodium, water moves from the ECF to the ICF. Signs of dehydration occurs wrinkled skin due to loss of elasticity. As the ICF increases and the ECF will reduce. This type of dehydration occurs when the water intake is inadequate. Hypernatremic dehydration. In about 5% of the cases, especially when the child has been given fluids with more salts, the serum level may be elevated, more than 150 milliequivalents per liter. Water moves from inside the cells to the extracellular compartment. ICF becomes low, ECF becomes normal. This may mask the physical findings of dehydration, and the patients may be undertaken as mild dehydration even in the presence of severe dehydration. Complications of severe dehydration may occur due to delay in the management. So, hypernatremic dehydration is more dangerous. Assessment and treatment of dehydration. Conditions, we look at the eyes, tears, mouth and tongue, thirst, skin pinch, and then decide and then treat. Eyes. Okay, if the condition of the patient is well alert, it is use treatment plan A, no signs of dehydration. Restless and irritable is some dehydration, and treat with plan B. Lethargic or unconscious or floppy, then plan C, severe dehydration. So eyes normal, sunken, very sunken and dry. Tears present, absent, absent. Mouth and tongue moist, dry, very dry. So eyes normal, sunken, very sunken and dry. Mouth and tongue moist, dry and very dry. Tears present, absent, absent. Thirst, drinks normally not thirsty. Thirsty and drinks eagerly. Drinks poorly or not able to drink. The child is very tired because of diarrhea. So drinks normally not thirsty. That is first one. Second one is drinks eagerly. Thirsty. Third is drinks poorly. It's very thirsty but it's not able to drink. Skin pinch goes back quickly, goes back slowly, goes back very slowly, quickly, slowly, very slowly. So decide the first case is going to be the child having no signs of dehydration. Use treatment plan A. If the child has two or more signs or including at least one sign, there is some dehydration. Treatment is plan B. If the patient has two or more signs including at least one sign, there is severe dehydration. Weigh the patient and use treatment plan C urgently. Skin pinch is less useful in children with marasmus where there is severe wasting or in case of infants. Kwashiorkor, uh, severe malnutrition with edema and obesity. Okay. So treatment plan A, B and C. A, no signs of dehydration. Mothers are educated to use increased amounts of home available fluids. ORS packets given for use at home. Breastfeeding should be continued. Treatment plan B, some physical signs of dehydration, rehydration therapy, correction of existing water and electrolyte deficit, and maintenance therapy. So, rendu therapy, rehydration therapy and maintenance therapy. Rehydration therapy 75 ml per kg of ORS in the first 4 hours. Maintenance therapy 10 to 20 ml per kg ORS for each liquid stool. So maintenance is replacement of ongoing losses due to continuing diarrhea. Begins when the signs of dehydration disappear, usually in the first 4 hours. Treatment plan C, start IV fluids, ringer, lactate, normal saline can be used. Dextrose is not effective. 100 ml per kg should be given as follows. Less than 12 months to 5 years. 30 ml per kg in 1 hour. 70 ml per kg in 5 hours. 30 minutes, 2.5 hours respectively.